Welcome to Locally Sourced. I'm Armanda Familetti. Everybody is talking about affordable health care, but what are they doing about it? Well, the League of Women Voters of Putnam County and my guest, Lillian Jones, are doing something about it. Welcome, Lillian.
Thank you very much, Armanda.
So, Lillian, tell me what the Putnam League of Women Voters is doing.
Well, I'm very excited to be chair of the committee, the Health Committee for the League of Women Voters, and currently we're putting together a program for May 23rd, where it's going to be an educational forum with some people who know an awful lot about healthcare in the state of New York. And they're going to be providing information to people so that they can get more updated on all the bills that are in front of the state legislature now.
Okay, so you said May 23rd, where?
At the Mahopac Library, and it's actually co-sponsored with the Mahopac Library.
And what time?
At 6:30, from 6:30 to 8:45.
Okay, and so tell me a little bit about what people will see when they come to the forum. What are they going to learn? Who are they going to see?
Well, that's a very good question. We're going to start out the forum with having one of our local members speak about a personal story of what he went through without health insurance and how he got health care and what the issues were with that. We have Senator Rivera speaking. Senator Rivera is the Senate Health Committee chair in the New York State Senate, and he's going to be talking about the new bill that's been introduced on health care. As you may know, the Assembly has passed a bill for health care reform over the last 3 or 4 sessions. And this one, this year, because there is a better chance of passing a bill, the bill has been expanded, and Senator Rivera has added long-term care to it and some other issues that he'll be talking about. So we're excited about that. Peter Arnow, who's an economist, is going to be speaking also, and he'll talk about the amount of money that it's going to save people of the state, which I know people are very nervous about it, but I think they'll be glad to hear his figures. And then we do have Katie Robbins speaking also, and she's the director of the New York Healthcare Campaign. They've been working, actually League of Women Voters is a member of that campaign also, as are about 50 other organizations in the state. And she's going to be talking about what they've been doing for health care and how we can help if you want to help pass the bill. She's going to be giving information as to how that's happening and what's happening statewide with the bill.
So you said you were the chair of the Health Committee for the Putnam County League of Women Voters.
Yes.
Why is this issue important to you?
To me personally?
Yeah.
I think I've always had an interest in health care. You know, I worked for a national health care organization for 30 years.
Mm-hmm. What organization is that?
Well, the American Cancer Society. And during that time, I did join or facilitated the starting of a group called Hudson Valley Access to Healthcare. And one of the reasons that we started that was that while we used to do a legislative forum every year, and we changed the topics, it became apparent about 11 years ago that if you really want to affect healthcare, if you can have all the good treatments in the world that you want, and you can have all the medications that have been developed, but if people don't have access to that, to health care, they're not going to be able to take advantage of all the good things that we have to offer. So we started doing monthly information source for resources for a lot of the different agencies in Westchester and the Hudson Valley. That has evolved into monthly information sessions, and this certainly, joining the league and getting involved in the program since I've retired has been a good follow-up to that. One of the nice things that was done is that we were able to, during the investigation of what the healthcare issues were in Westchester and Putnam and the rest of the Hudson Valley, we held hearings that ended up resulting in the bringing in of the federally qualified healthcare facilities that is in Brewster now, the open door. So we facilitated that, which was has provided great access for people in this county. So this getting together with League and seeing all their national resources and state resources, and seeing that they have they've done a study on healthcare, and they have things that they're supporting with the healthcare issue. So it's been a good fit for me.
So you mentioned that the League has done a study. So most people think of the League of Women Voters as registering voters and having candidates forums. That's sort of what they've been doing for 100 years. But you said they did a study. So that part a lot of people may not know about the League, how in depth they go into studying policy issues and then taking a position.
Correct, and they do that nationally and across the country. All across the country, and in New York. And New York and national have a position on health care that was studied and voted on. And actually they do that with their school positions that they take, the property tax positions that League takes,
What's
the water
involved
quality.
in a study? How in-depth is it? What kind of research do they do?
Well, I can tell you what how it's worked in the past. And being just a recent new member to the League here now for 2 years, I haven't researched how we're doing it right now in any great detail. But we used to have study guides, and you'd have questions that you'd have to answer, and you'd have to really look into the statistics on things, and then your League would have to take a vote to see if
Your
it's
local
something,
league.
your local league. But of course, all the local league stands have to go with they have to be coordinated with the state league chants. We can't take a position that's opposite of the state league on that.
So the policy positions bubble up from the local leagues.
I think they bubble up from the local league, but they also come down from the national leagues. You know, we do have people who are lobbying at the national and state level that do understand what's going on with policy, and they're studying it on a day-to-day basis, so they have a much better idea as to what's going on and what's going to affect the local issues, and then local people see what's going on and they send the information up. So I think it's a good a good coordination between the groups.
So I just want to say that I'm a member of the League, I'm on the board, and I'm on your committee for health. And I think I'm there because I believe that access to quality health care is a human right. That's my belief. Are you there for similar reasons?
Well, of course I think it's a human right, but then the devil's in the details on that, right? I mean, I'm there because I realize that it's really unfair. We have a very unfair health system now where a great number of people who can't afford health care just don't have access to longevity. You know, in the United States, we don't have as long a lifespan as they do in most countries. We have a higher infant mortality rate, which is not good. A lot of people just don't have access to the system at all, and those that do still have to pay a lot of money. It's the lack of total health insurance leads to bankruptcies in this country at a high rate, and I just don't think it's fair that people should have to suffer just because they don't have the money to access the system.
I think it's interesting when you look. You don't have to go very deep to find out that the United States per capita cost for health care is the highest in the world by far, yet the quality of the health care that we receive, like you say, figures for longevity and maternal and child mortality are really quite low on the scale of other industrialized countries. And I think we're even below some non-industrialized countries in those areas. So that's something I think that if more people understood, then maybe they would say, there's really something wrong with the way health care is doled out in this country.
Right, but the one word I would disagree with you on is quality. I think we have a high level of quality in this country. I think access is the issue that causes all the problems. You have a lot of areas in this country where people can't get care. They're in rural areas and there aren't hospitals nearby. You could have a great quality hospital 200 miles away that isn't going to do you much good when if you have an emergency situation. So I think there are a lot of issues that bring our numbers to something that we're not really proud of. But I think a lot of it has to do with access to care.
So tell me about what you said about rural areas, that they don't have enough access to care. Why is that? Doctors don't want to move to rural areas? They can't make enough money?
I don't think I'm as pessimistic about that as you are. I think that it's just geography in the country and where people live. We're used to being able to drive around the corner, and you can get to our hospitals
there's a
very
doctor
quickly.
on every corner,
there.
I think, in Putnam and Westchester.
But that's not the case. I mean, you've seen some of the TV news programs where you have dentists that go out somewhere in the rural Midwest, and when that happens, you have 500 people coming in from all over to try to get health care. I just think it's how this country is set up, and if you travel around a lot, you can see that that geography is an issue. And even now, when you talk about it in this country, think of all the things that happen for people to have to access health care. If you have somebody who is working 6 days a week at minimum wage, can't take off from work to get to health care, that's a problem for them, right? And it makes it more difficult to access the system. You have people who can't afford to take all their medicines. They can't afford the payments on it. There are a lot of things that go into the healthcare system, and it's not just, what does your doctor charge or what does the insurance company charge. It's what you have access to in your lifestyle. If you have to work, if you have a caretaker at home to help, it's really a very multifaceted issue.
It's a very complicated issue. So let's get back to a minute to the bills that you said the Assembly has passed 4 years in a row. What is
4 sessions.
4 sessions in a row. What is it called? The bill?
The New York Health Bill, I believe.
Okay. And now, because there are Democrats in both the House and the Senate, there's actually a chance that that bill would be passed in the Senate. So now is the time to get down to the nitty-gritty in terms of working out all of these complicated details, if there is a political and public will to have universal health care in New York. So tell me, what is the broad idea for what both bills are for, and then a little bit about all the little nitty-gritty that would have to be worked out.
So what they've added to the new bill is long-term health care.
But what was the original bill?
The original bill. So the original bill was that everybody would have access to health care, right?
And by everybody...
So I'm reluctant to answer that question specifically because the details of it are what we're going to be discussing at our forum to begin with, which is really great. But they've changed over the year. And right now, the Senate has added long-term health care to the bill, which is something that Assemblyman Gottfried had wanted to put in but hadn't put in. And there's been a passage of some bills that have added some drug treatment. So it's in flux right now. And with everything changing so much in the news every day, I'm reluctant to say what it is exactly today. But if people wanted to add their feelings on what should be included or their concerns about it, on May 28th, there is going to be a public hearing in Albany. The League of Women Voters does have a person who's the chair of our health committee for
the state,
for the state altogether and for Westchester. And I know that our president, Eileen Riley, and myself have been attending some of her meetings also. And she's going to be up in Albany on the 28th testifying as to the needs of all of this. And there are a lot of special interest groups that are now concerned because now they think that it might be more of a reality. The Senate is 2 votes shy in sponsorship of having a majority. But everybody, again, is looking at it much more closely now in terms of the numbers. They're thinking that you have to look at the numbers for health care in the whole state. There are a lot of different systems that would be rolled into this. And if you look at all the health care numbers, it looks like this is going to save people money because there are a lot of things that come out of the systems, like insurance companies. the part of the money that goes to insurance companies in the current health care system varies by insurance company in terms of what their administrative costs are, but it's somewhere between 14 and 18%. So there are a lot of potential savings in it, and there certainly are some costs, and it's not something that you're going to vote on one day and implement the next. It's going to take a couple of years to implement it. Okay. And now the discussions are much broader. I've heard from some of the senators that they really want to make sure that some of the groups that have some issues with the bill as it stands now are on board. So, there'll be some maneuvering going on now, and hopefully it'll all result in just better access for everybody in New York.
I hope so. And also at the same time, there's discussion about universal health care and other names like Medicare for all happening at the national level.
Right.
So there's so much going on in health care. Where would you tell people to go to get more information about, if they really want to dig a little deeper into all the complications, all the different proposals that are out there? Where would you say they should go? Would it be New York Campaign for Health?
New York Campaign for Health has a great website, and it has resources that are very, very helpful to go into. They go into a lot of the money studies by different institutes. It goes into the costs per person. It has a vast amount of information, but there are a lot of sites out there, a lot of places to go to look at that. And of course, I think people tend to go to the sites that reflect their own philosophies. But certainly coming to our forum on the 23rd would be helpful, because we are going to have people talking about it, about the costs and how it's set up. And then nationally, there's so many different programs on now. And I think if you watch a network that's not your usual network to watch, I'm sure you get scared. And people tend to have their own views of what's going on. My general feel is that, from the research I've read on it, is that having a national healthcare system or a state system would certainly help bring our numbers up to having people have more access to healthcare, live longer, and I think that would be a good thing for all of us.
Less bankruptcies. It's so amazing to me that in our country, so many people, it's one of the highest causes of bankruptcy in the country, is that someone either is underinsured or not insured. They have a catastrophic health issue. Their lives are destroyed.
Right.
They lose their house, they go into bankruptcy, and if their lack of insurance or minimal amount of insurance may cause them to actually die.
Right.
That might be the end result, because they can't, as you say, they can't afford the medication, they can't afford the procedures. Sometimes even with health care, you apply to have a certain procedure, they'll deny it. We've heard about that on the news all the time. And then it takes some sort of, GoFundMe campaign to get that person the health care they need. This is no way to run a railroad, as people would say. Tell me about other countries. So the United States is one of the last countries of the industrialized world that doesn't have some kind of systematic health care that everyone is entitled to. So why is that? Is it the insurance companies are they're just making too much money and lobbying too hard, or?
I don't think there's an easy answer for that, but and I don't know how the different countries have had different evolutions of the healthcare system. In this country, we've always promoted a free enterprise, and heading towards healthcare for everybody is certainly the way to go. We do have Medicare that took a while to get in and passed. We do have Medicaid, so there are a lot of people who are already covered under systems. The veteran system provides health care for people, and I think that actually the percentage of people that are covered by some sort of government program are much higher than you think. So the number of uninsured has gone down, certainly, but there is a large amount of underinsured also. And it's
I'm sorry. I just want to go back to, not a few years ago, but in the Obama administration, there was the Affordable Care Act. And
there still is the Affordable
Health
Act. Yeah.
But I mean, that's where it started. And I assume that has, like you say, a lot more people are have access to coverage
Right.
now that didn't. But that doesn't seem to be a perfect plan either. So what's being proposed now in New York and nationally is an improvement upon the affordable health care, right?
I don't think that when the laws first come in on this that they're going to be the perfect plan and work out perfectly. And I think that I don't know of many people when the Affordable Health Care Act came in that thought, oh, this is the perfect answer to everything. I think most people saw it as a starting point and that you had to work your way into it and see what the problems were and then make changes as you went along in it. And there was certainly a strong group of people who are not in favor of having everybody have health care. So that, we have a political system that operates the way it operates. Hopefully we'll have better health care. Hopefully one of the versions of the national programs that are being proposed will help lead us into better care than we have now. We can make improvements along the way, and hopefully we'll get in New York. If nothing happens nationally, I'm hopefully in New York we'll be protected and get our own healthcare system here, which would be terrific.
Okay, so that like you say, there's so many loose strings to be knotted up with this. It's just so complicated. We're looking, maybe 5-10 years down the road for something like that.
I think we're looking a good. I think that after the national elections, New York will have a better idea as to what to do. Because we do need certain kinds of waivers in the state to pass a New York health care law. My guess is that after where we see what's happening nationally, we'll have a better idea of where to go, and then it'll take maybe 2 or 3 years to pass something locally, and then you have to implement it.
Right,
it's going to be a big change in how things work.
Well, I remember Affordable Health Care Act, Obamacare, was phased in over several years, right? Until I think it's completely phased in finally now. There's also some talk at the national level about dismantling Medicare and dismantling Medicaid because it's too expensive. It seems like I've heard those conversations a lot. So what's happening there? It seems like the public will to dismantle those programs is nil, right?
I would think so, and I'm certainly not an expert on the national healthcare system at all, but it seems to me that we always have curmudgeons that are trying to dismantle things and to say this is
too costly.
People shouldn't have everything. If you can afford it, you can do what you want, and if you can't, you shouldn't.
You should just die.
You should just die. Yeah, it's
reduce the excess
right?
population.
But I mean, we have some very strong philosophical differences in this country right now. And while you and I might think that healthcare is right and that everybody should be taken care of, not everybody does.
Right.
And there are industries that are involved that are going to be restructured. What I think of all the time is when I first, lots of years ago, when you had all the blockbuster videos.
Right.
You had a lot of things in this country that we used, and then new technology came in, and they all went away.
Right.
Because new technology took over everything. And I think the same thing is true with what's going on now in healthcare. People are afraid of the changes. It's going to take some adjustment for them, and some people adjust quicker than other people. But I think that 10 years from now, you're going to look at healthcare in an entirely different way, and I think that'll be, we'll all get through it, and hopefully we'll be healthier.
So at this, at the forum that's happening on the 23rd, Mahopac Library, 6:30 p.m. People are going to have a chance to ask questions, because it seems like
they are.
The more you hear about these issues, there's so many questions arise. So we're going to hear about the pros and the cons, and people are going to be able to get up and ask these experts directly what...
Yes, there will be a question and answer period. People will fill out cards. We'll have index cards so that we can shuffle through them and ask the questions.
Right, because we're going to get several questions that are pretty much similar. So what the league does is they say, we've got 4 questions about what's going to happen to Medicare, so we'll make it one question about what's going to happen to Medicare.
And hopefully speakers will be able to answer all those questions. So looking forward to that.
Yeah. I remember the League of Women Voters of Putnam County just, it was like 2 or 3 years ago. You had a health
2 years, yeah.
2 years ago, and the room was packed. It was in the community room. They were standing room only.
Yes.
So obviously a lot of people in our community are interested in this subject, so get there early and get a seat, because
absolutely.
it's going to be very informative, and a lot of people are going to turn out to find out more about health care. So let's talk a little bit more about the League. We just have a couple of minutes left.
Okay.
And one of my jobs, along with being on your health committee, is I'm the chair of the membership committee.
Yes.
And we're all volunteers, and there aren't that many of us, and we're all out there registering voters, having candidate forums. We just sponsored one for the Carmel Board of Education forum. And we could use new members. We could use more people.
Could.
We could use members who just think that the League is important and the work that we do is important, and just pay your dues. It's a membership organization, and that helps us tremendously. But also we need people who are out there in the field. The more people we can register to vote, the more people who can man and have these kind of forums is important. So just look at that number on your screen, the phone number, and call it and say that you want to be a member of the League of Women Voters of Putnam County, and we'll make sure that happens for you.
That would be great.
Because it's a fun bunch, too. I mean, it's not all, important, serious work. We do have a good time with the League, and you do not have to be a woman to be a member of the League. We have several men in the League who do a lot of work and support the cause, so that would be great. So that's my plug for the League of Women Voters. So we just have about a minute left. Is there one important thing that we didn't touch on during this conversation that you want to make sure gets said before we sign off?
No, I think you were very thorough in your questioning, and I look forward to seeing as many people as possible at our forum on the 23rd. And there is actually, if you can RSVP to the library, that would be terrific, and it would help us understand how to set up the room.
How many chairs to put out.
How much.
Okay.
So
thank you so much.
No, well, thank you, and I appreciate the invitation.
And thanks to the crew that comes out, all volunteer, and of course the people who watch. Thanks.